Before we move into the technical session proper, I would want to adjust the program we have here in such a manner to make it more palatable and more suitable so that we will not waste much time here today. To that effect, I want us to do it this way. First and foremost, the sponsors of these bills will be given 5 minutes each to come out here and make their presentations one after the other, starting from the sponsor of the first bill.
Mr. Chairman, honorable colleagues, today is really important to me as a member representing my people. Let me first of all express my sincere gratitude to Almighty Allah, who has seen us through this far in the discharge of our legislative duties to our constituency and the nation at large. Today's public hearing on the bill for an act to establish Federal Medical Center Fufu, Kwara State, is an historic moment, not only for the good people of my constituency, Kwara State, but Nigeria as a whole.
Welcome you all to this public hearing on the bill for an act to provide for the establishment of the Federal College of Nursing and Midwifery, Otugene, and related matters. The bill seeks to provide legal framework for the establishment of this college in Delta State. We all know that nurses are the backbone of the healthcare industry, both locally and internationally.
Distinguished, I thank all who are here today to witness this part of the process of this bill. The public hearing for the bill for an act to establish the National Hospital, Port Harcourt. Let me express my very profound appreciation to the Honorable Chairman and members of the House Committee on Health Institutions for all their effort and hard work to bring us here today. The bill answers the yearning of all of us as we wish to have easy access to health delivery. It is important to emphasize that the legislative process we have undertaken, including the public hearing and even up to presidential assent to this bill, is to create a legal framework for the establishment of a national hospital in Port Harcourt. Mr. Speaker, the word legal framework is important to me because even the Speaker mentioned it in his speech.
First of all, I want to clear the issue of the name Azare. Whenever you talk of Azare, the biggest Azare town is in Bauchi State. But there are 2 other towns or villages called Azare. The local government from where I come from, in Borno State, Hawul, the capital is Azare. And this is where we are proposing that this Federal Orthopedic Hospital be located, Mr. Chairman. Now, by sheer coincidence, the way Abuja is central in Nigeria, Azare in Borno State is in the southern senatorial zone, and it is central to the northeast geopolitical zone as a whole. In fact, even though it is in Borno State, Azare is closer to Damaturu, is closer to Yola, is closer to Gombe than Maiduguri. It's only Bauchi and Jalingo in Taraba that are slightly further away than Maiduguri. So I'm explaining this so that you know that this specialized hospital is to serve the northeast geopolitical zone that has 26 million people.
And honorable members of the House of Representative Committee on Health Institutions, on behalf of the Council of Chiefs and the good and peaceful people of the Guyana Kingdom, in particular, the Ugwumsinachi South and Udu local government area of Ugwumsinachi and Udu Federal Constituency in that state, I convey our sincere greetings and profound appreciation to you all. Mr. Chairman, I'm here to present this memorandum in support of the bill for the establishment of Federal College Nursing and Midwifery in Otugene, Delta State, Federal Republic of Nigeria.
Health, they say, is wealth. Yes. That is why we, Urobo Progress Union, which is the socio-cultural organization of the Urobo, the Abuja branch, we are here to present this memorandum support. My name is Bernard Okiefete Nafaga.
Okay, we are moving to Bill number 4 for an act to establish the National Hospital Port Harcourt in Rivers State and related matters.
I am Professor Chizindo Aliko, the chairman, Nigerian Medical Association, Rivers State branch. I'm here on behalf of the entire doctors working in Rivers State in particular to support this bill for the establishment of the National Hospital Port Harcourt.
The Nigerian Medical Association is interested in bills that will bring health and health services to our people at affordable, available, and accessible to them with minimal stress in any form for our people. To that extent, whenever we hear about the establishment, looking at the logistics and hardship people suffer in accessing health, we are impressed and we are moved.
I assured Nigerians there was a promise I made them that I must leave the health institutions in Nigeria better than I met them in that 2019. And no sooner I took over as the chairman than I started making moves geared towards actualization of that promise I made to Nigerians. I first undertook a tour of all the health institutions we have in this country, funded by the federal government of Nigeria. And when I came back from that trip, I made recommendations to the federal government, and to the glory of God, they responded in a very, very affirmative manner, especially in terms of funding of the institutions. They stepped up, most especially in capital provisions to the health institutions. And leaving the health institutions better than I met it also includes having more health institutions to cater for the health needs of Nigerians. And that is why I will be very, very reluctant to withhold assent in these requests, assenting to these requests made by my colleagues, because there is no way I can say that if you have a federal university teaching hospital in a whole state, you cannot have a federal medical center again. Considering the fact that most of our state-owned health institutions are so underfunded, they do not have equipment, they do not even have the manpower. Most times the doctors and the paramedical staff, they are on strike. So who takes care of the health needs of this teeming population of citizens of those states in need of healthcare services? So one thing I must promise Nigeria is that even though there are standing rules, extant laws on the establishment of institutions, we must try as much as possible to see how we can bend those rules so as to create opportunity for the accommodation of most of these very reasonable requests that are coming our way.